Hello everyone, welcome to Aristo's virtual learning series. So far, we have discussed about anatomy and physiology of four body systems with our previous modules. Now, we are going to focus on our core therapy area. As you all are aware, anti-infective is the major forte of Aristo. So, first let's understand the basics of anti-infective. Another widely used term for anti-infective is antibiotic. These are the drugs which are used to treat the infection. Now you will ask, what is infection? So infection is the disease caused by harmful microorganisms. So there is one specific term which is used for these harmful microorganisms, and that is pathogen. So pathogens are nothing but harmful microorganisms. There are different types of pathogens available in our nature, such as protozoa, fungi, bacteria, and virus, out of which we are going to focus or learn about bacteria. Bacteria are microscopic single-celled organisms which survive in diverse environment. Bacteria has a simple structure. It is generally surrounded by two protective covering, that is cell wall and plasma membrane. Bacterial cell contains genetic material and ribosome. The long whip-like extension is called as flagella. Now we are going to understand the important structure of bacteria along with its role. Cell wall. Cell wall is the outermost covering of bacterial cell. Cell wall gives shape and rigidity. If we magnify the structure of cell wall, so this rigidity or strength to the cell wall is provided by one substance that is called as peptidoglycan. So peptidoglycan is responsible for the mechanical stability of cell wall. Linear chains of peptidoglycan are held together with cross-linking by transpeptidase enzyme. This transpeptide is also known as PBP, that is penicillin binding protein. So peptidoglycan and transpeptidase both together are responsible for the mechanical stability or strength of the cell wall, which is very essential for the survival of bacteria. Bacteria contains a single molecule of double-stranded helical DNA as genetic material. It either floats freely in twisted thread-like mass, which is called as nucleoid. Genetic material or this nucleoid is responsible for controlling all the functions of bacterial cell, and it is very essential for the survival and reproduction of bacteria. Bacterial ribosomes are the spherical unit where the protein synthesis, that is formation of protein, takes place by using the information encoded by the ribosomal RNA. Bacterial ribosome is made up of two subunits, namely the 30S subunit and 50S subunit. Bacteria is able to cause infection in human being. If we want to win over this bacteria, we must be aware of right target sites. So let's understand the target site where we can hit the bacteria with our antibiotics. So the first target site is cell wall. So there are certain antibiotics which are interfering or inhibiting the cell wall synthesis and thereby able to kill the bacteria or stop the growth of bacteria. And the examples are like megacv, montas, and azinam in our division are acting on the cell wall. The second target site is ribosome, which is a protein factory, and drugs like micacin and azevent are working on this target site. Then the third one is the nucleus, or you can say genetic material. So the drugs like Omsef and particularly ofloxacin in Omsef acts on this target site. In battle, it is necessary to understand about the enemy which we are fighting with. So let's understand this pathogenic bacteria with its classification. So bacteria are classified on the basis of two criteria. The first one is the oxygen requirement for survival, and the second criteria is the characteristic of cell wall. On the basis of oxygen requirement, bacteria divides widely in two major groups. First one is aerobic bacteria. So these are the bacteria which require oxygen for the survival. Most of the bacteria fall into this category, whereas there are certain bacteria which don't require oxygen there for their survival, or you can say they are survived in absence of oxygen, and it is known as anaerobic bacteria. There are very few members who belongs to this family of anaerobic bacteria. Cell wall characteristic is another way to classify bacteria, and it is done with the help of gram staining method. It is nothing but unique coloring technique developed by scientist Gram. So we'll be focusing on the end result of this gram staining method. With this picture you are able to identify different colors, and these different colors are nothing but representation of different group of bacteria. So the bacteria which adopts blue color are grouped as gram positive bacteria. Bacteria which acquires red color as grouped as gram negative bacteria, and there are some bacteria which are colorless. They are known as atypical bacteria, and this color which is adopted by gram positive bacteria and gram negative bacteria is because of difference in their cell wall, particularly the thickness of peptidoglycan. So this color ultimately is absorbed or adopted by peptidoglycan, whereas atypical bacteria are not having typical characteristic of peptidoglycan cell wall. So because of absence of peptidoglycan, they don't acquire or adopt any of the. So bacteria are widely classified in two classes, that is anaerobic and aerobic. Most of the bacteria fall under the category aerobic. That's why it requires further division, which is done with the help of gram staining. And as a result, there are other three categories which are there are gram positive, gram negative and atypical. So in totality, there are four different groups of bacteria are available, namely anaerobic bacteria, gram positive bacteria, gram negative bacteria and atypical bacteria. So here are the different members of these groups. So in gram positive bacteria, some examples are Staphylococcus aureus, Streptococcus pyogenes and Streptococcus pneumoniae. The gram negative, which are dangerous one, are Klebsiella species, Escherichia coli, then Acinetobacter baumannii and Pseudomonas aeruginosa are the major culprit. Then Salmonella typhi, Shigella dysenteriae, Haemophilus influenzae and N. meningitidis are the member of gram-negative family. In atypical, some examples are Chlamydia pneumoniae, Mycoplasma pneumoniae, Ureaplasma urealyticum, Chlamydia trachomatis and Mycoplasma genitalium. And to anaerobes, few members are bacteroids, Peptococcus and Peptostreptococcus. Whenever patient visits doctor with some symptoms, and if doctor identify that there is infection, so doctor will prescribe some anti-infectives along with other supportive medications. While prescribing antibiotics, doctor looks for certain criteria such as activity of antibiotic and pharmacokinetics profile of antibiotic, which are related to the chemical structure, and the third criteria is resistance. First criteria, spectrum of activity, talks about coverage of antibiotic. Depending on that, there are three classes. First one is narrow spectrum. If antibiotic is able to cover any one of the class of bacteria, it is known as narrow spectrum. If antibiotic has capacity to cover two classes, maybe gram positive, gram negative or gram positive, atypical. So that antibiotic is known as broad spectrum antibiotic, and if antibiotic has capacity to cover more than two classes of bacteria, it is known as extended spectrum antibiotic. Antibiotic which belongs to any of this class is a good drug for treating infection. The second criteria is pharmacokinetics. It related to the property of drugs. How my body is going to respond to the drug which is consumed. So the first criteria is bioavailability, which talks about the amount of drug available to show its action. And higher the bioavailability, better is the drug. Second criteria is MIC, which stands for minimum inhibitory concentration. Lower the MIC, better is the drug. Then Cmax talks about maximum concentration of drug. Higher the Cmax, better is the drug. Then Tmax talks about time taken by drug to reach Cmax. So lesser the Tmax, better is the drug. Then half-life. Longer the half-life, lesser is the dosing frequency. And another criteria is ppb, that is plasma protein binding. So if higher the ppb, lesser the dosing frequency. So out of this, half-life and ppb are the two criteria which will decide the dosing frequency of drug. So the drug can be given OD, BD or TID depending on the half-life and ppb. Antibiotic is prescribed by doctor to treat infection and thereby resolution of symptoms seen in the patient. So we can say that it provides cure from disease. In this case, the bacteria is susceptible to the antibiotic which is prescribed. Another case, even after taking antibiotics, symptoms will persist, disease will progress further. This may be because of inadequate dose of antibiotic, maybe inappropriate drug, or it may be because of resistance. So in this case, doctors has to go for choice of another drug to treat this infection. Let's focus on the respiratory system infection. First, we will be starting with upper respiratory tract infection. In this, if sinuses are infected, it is known as sinusitis. If tonsils, which are the part of our defense system, are involved or infected, then that infection is known as tonsillitis. If the part pharynx get infected, it is known as pharyngitis. If tonsils and pharynx both together are involved in infection or infected, then it is known as pharyngotonsillitis. And one more part of upper respiratory tract is middle ear. Ear, in scientific terms, it is known as ota. That's why the infection of middle ear is known as otitis media, which is presented by short abbreviation OM. Then there is one of the short abbreviation is AOM, which talks about acute otitis media. The term itis, ITIS, is representation of inflammation. Let's focus on lower respiratory tract infection, and the prominent infection is pneumonia. Pneumonia is nothing but infection of lungs. In this infection, there is inflammation in the air sacs, that is alveoli. The alveoli filled with fluid or pus, and it making it difficult to breathe. Depending on mode of transmission, pneumonia further divides in three categories. That is, first one is CAP, that is community acquired pneumonia. Second one is hospital acquired pneumonia. So the patient got this pneumonia within the hospital stay, or precisely post 48 hours of hospitalization. Then third one is ventilator associated pneumonia, and the main causative organisms for pneumonia or the pathogens responsible are Klebsiella pneumoniae, Pseudomonas species, and Streptococcus pneumoniae. Another major complication is COPD, that is chronic obstructive pulmonary disease. It is a progressive lung disease. In COPD, there are mainly two forms of COPD. First one is chronic bronchitis, which understood as inflammation of bronchioles along with excessive mucus formation. So there is a long-term cough and mucus is associated in this chronic bronchitis. And the second aspect is emphysema, which talks about the damage to the lungs over a time. So these alveolar septums are totally damaged, and that's why it is really very difficult to breathe in COPD patient. The main symptoms are poor airflow, shortness of breath, cough along with sputum or mucus. Now we'll be focusing on some main gastrointestinal tract infection. The first one is typhoid. Typhoid is also known as enteric fever as it originates from small intestine, and the another term for small intestine is entero. Symptoms of typhoid are like high fever, there will be stomach pain, abdominal pain, patient may feel weakness, and there may be episodes of vomiting as well as loose stools. The main causative organism for typhoid is Salmonella typhi and Salmonella paratyphi, which both are gram-negative microorganisms or pathogens. Then we will be focusing on another infection that is known as intra-abdominal infection. In short abbreviation, it is denoted as IAI. So intra-abdominal infection is a group of infection that occurs within the abdominal cavity, and particularly it involves peritoneal inflammation. Peritoneum is the normal covering of GI tract or abdominal parts. And the main causative organisms are like Pseudomonas aeruginosa, E. coli, Klebsiella species and Acinetobacter species. So friends, with this module we understand or learn about pathogens, their ability to cause infection, classification of this pathogenic bacteria, along with some infections of respiratory tract and GI tract infection. We also cover how doctor is selecting antibiotic and which criteria he is looking for in antibiotic. So thank you for your patience listening. Thank you. Stay home, stay safe.